Good morning. Labor Day is over. We're back. It's Dr. Burchett. Let's talk about fat shaming today. There's a couple videos I want you to watch. The first one, we're going to watch these videos. We're going to talk about it. We're going to talk about shame, fat shaming. Does it work? What's a better way? And then something you can do to feel actually good about yourself. I'm excited about this. Watch this video first. So on Facebook today, I'm trolling, and I see Nicole Arbor, who's this skinny blonde, she's a comedian, she's got a website. She's pretty offensive, and I'm not gonna lie, she's pretty funny. So she puts out this video called Dear Fat People. I want you to watch that video right now. Tell me your reaction to it, okay? So I watched this video, and I'm not gonna lie, I laughed. It was funny. I had this is some of the stuff she says. Dear fat people, fat shaming is not a thing. Fat people made that up. Some fat people are going to be really mad at this video. What are you going to do? You're going to chase me around? I can get away from you by walking at a reasonable pace. And she also says, as she's touching her hair, I don't know if this is hairspray or semen. Disgusting. Like, that's disgusting. But that's funny. Like, I laughed. After I laughed a little bit, I just, like, she kept going and going and going. And then I kind of started to feel bad. I was like, I just kind of felt sick inside. I can identify part of me with some of the excuses and frustrations as a doctor that works with patients whose health behaviors are not what's best for them. I can identify with that frustration. I can identify with a feeling to want to blame people for their problems, you know. The first thing that I would encourage you to do is have the courage to not... Nicole is going to get blasted. She's going to be lit up. YouTube dropped her website. She's going to get in big trouble for this. But I think the real opportunity here is for you and me to look on the inside and to see how we really feel about this stuff and what part of our human nature this exposes. This is an opportunity for growth for us. Now, this is followed by, I want you to watch this other video. The other video, let me get you the name, is by Whitney Thor, who is the star of the TLC show My Big Fat Fab Life. And give me your response to that. So I watched the first one. I laughed. I kind of felt bad. Then I watched the Whitney one, and at first I felt bad. She put me back in my place. And then it ends on a great conclusion with hope. I really admire this woman. She's over 300 pounds. So she puts this video out defending, kind of blasting Nicole for putting out this offensive video at the expense of the obese. And I really admire her courage to do that. Her head is straight. I think she is, a lot of the things that she is saying is really making this world a better place. So good for her. That video is worth watching. It's going to make you feel good. But let's talk about shame. Let's talk about this for a minute. What is fat shaming? What is shame? Shame is the feeling that you're not good enough, that there's something wrong with you. So fat shaming would be, what's wrong? I'm fat. I'm obese. What's wrong with me? I weigh over 300 pounds. I'm not good enough for X, Y, or Z. I'm not good enough in life for my work to be happy for somebody, whatever. It's that feeling. It's that feeling. It's the master emotion. And it drives a lot of what we do. I'm a big believer in shame, and that most of us need to focus on recovering from that to really live a happy life. So does using shame actually help to, again, Nicole is going to benefit from this tremendously. She's got over 20 million views on YouTube. The more controversy, it's going to drive traffic to her site, and when she gets traffic, she monetizes. She makes money on this. That kind of makes me angry. This is at the expense of people who suffer, We probably shouldn't feel good about that. does this work? I think at some level, I wonder in her heart if she thinks she's actually doing something that helps people, that somebody who's overweight is going to see her video and then they're going to change and it's going to help them. And the truth is it doesn't. It's counterproductive. In my experience as an ER doctor and a hospital doctor and working with patients to change behaviors, once you elicit their defensiveness, once you get them to feel bad about themselves, you just added one more thing that you're going to have to get over before you're able to get to living a healthier lifestyle, eating more vegetables, exercising, whatever you're not smoking, whatever your agenda is. It's not effective. What is effective? Like if we want to make this world a better place, I think part of it includes people living healthy lifestyles and being in better shape. So what do? I think the foundation, let me talk about one more thing. The foundation is love. I mean, to talk about a religious, spiritual, and touchy-feely thing, you love people. You love individual people. That's what you do. Nicole Arbor, probably not a very loving video. Probably going to set us back a little bit, the folks that watch that. So how do you do that? I think, number one, you have to establish trust and rapport. You have to communicate to somebody that you're really there for them, that you want them to succeed, you want them to be happy, you want to enjoy them as a person, that there's things about them that you like, that there's so many things about them that you like, starting with their physical body, the way they dress, to their personality and all that stuff. You know, positive, communicating positive things. If you really want to go there, you know, in my life, I'm a doctor. I wrote a book on diet and exercise, The Gentleman's Diet. It's on Amazon. It's amazing. Check it out. Had to plug it. In my personal life with friends and family, I never seek out to convert people, to talk to my good friend about smoking, I'm the doctor, right? Like, they know I'm here for them. If they want to make a change and live a healthier lifestyle, that's what I exist to do. Come to me and I'll help. But I'm not going to affect our relationship and put this thing in between us where you feel like you got to do it. It gets messy. If you are going to do it, I would do it from a place of love and concern. And that's a very different feeling. When you actually are trying to do something for somebody in their best interest, where do you feel that? I usually feel it kind of down here. Like that's my altruistic, God, I really want to help this person place. The place of, oh, I'm going to feel better about myself by putting somebody down, like that's a different location on my body. Like it feels differently. In other words, the Nicole Arbor place from which she was delivering that, which was, you know, entertainment and comedy and whatever, it's not the same place as a genuine, I want to help you. Let's do this one step at a time. Let's do it together. It's a totally different place. So you come from this place where you say, you know, I love you and I'm concerned. I want you to be around for the grandkids and I want you to be able to be active with me. And I'm worried I'm worried about your health. I'm worried about your weight. I just want you to know I'm supportive. I want to be here for you and do whatever needs to be done. Do you want to talk about this? Can I help you? Anything. Just throw it out there. That's it. That's how I would do it. And somebody responds, and maybe you can do things like make some recipes together or walk after dinner or do some exercise dates or active stuff. Whatever. But I would be careful about getting in there and doing that. I mean, imagine like if every time somebody smoked, you went up to them and said, you know, you're going to die from that. That's just taking years off your life. You're going to be sicker. You're da-da-da-da-da. Like that gets old pretty fast and destroys relationships. It's just, I don't know if that's the way to go. If you really want to make a difference, I think you love people. Now, how can we do that with ourselves? We really got to start with ourselves. This is what I'm trying to say. It all comes back here. One thing that I've found really works, and I do this, you go to the mirror and do it in the morning and find one thing about the way you look, your physical appearance, that you like. Could be your eyes, could be your smile, could be your hair, could be your boobs, your butt, whatever, your hand, anything. And focus on that. What does it feel like when you actually like yourself? When you actually look in and you say, God, I really do like this about myself. For me, it's like a warm, fuzzy feeling right here. I imagine it being like a pink, I don't know, something pink. My daughter would wear like a pink, fuzzy whatever on the inside. It feels good. Get that feeling. Get a sense of that feeling. I want you to make that feeling stronger. Let it grow in intensity until it fills your whole body. It's coming out your pores. It's overflowing. That's you liking yourself. Do that every day. Start looking with one thing and then look for another thing. If you look for what's imperfect, you're going to find it. If you look for things you like about yourself and what is perfect, you're going to find that too. I would encourage you. I think part of happiness is deciding to look for what's perfect and what's good and what you like, and letting go of the imperfections. Yeah, it's all imperfect. If you're always looking in the mirror, looking for your imperfections, and you're going to find them, and it's not going to feel good. You're going to feel bad. You're going to feel insecure. Am I good enough for this and that? Can I find somebody going to love me? All of this stuff, you know? That's what I would start doing. And in the same thing, as you do it and you look at yourself and on the inside, you know, you can do this with other people too, you know? Look and just pick out things that are positive about somebody else from the way they look. Again, their smile, hair, whatever, clothes. Who doesn't like a genuine compliment? Give me a break. I think that's part of the foundation that we need to establish before we even get to this issue of diet and exercise. Now, yeah, that's part of it. And health is absolutely a part of it. And this is a problem. We're not denying that. But fame shaming, fat shaming is counterproductive. And I would, let's use this as an opportunity to look on the inside. You know, I mean, that's how we're going to make this world a better place. That's what I got. What do you think? What did you think about the videos? You can see my hair. I don't know if I'm going to do this over.